In the heart of a bustling city, a hospital hums with the rhythm of countless lives, each heartbeat, each breath, a testament to the delicate balance of care that keeps people alive and thriving. This hospital, like many others around the world, is a beacon of hope for those in need of medical attention. But behind its reassuring exterior lies a complex, often invisible process that ensures the quality, safety, and reliability of the care it provides. Accreditation is more than a mere seal of approval. It is the lifeblood of healthcare standards, a rigorous assessment that holds institutions accountable to the highest levels of care. Yet, as the sun rises on new healthcare challenges, this vital process finds itself at a crossroads, grappling with profound challenges and pitfalls that threaten its efficacy and fairness. Around the globe, a handful of powerful accreditation bodies set the gold standard for healthcare institutions. In the United States, the Joint Commission, or TJC, reigns supreme. Established in 1951, TJC has grown to become one of the most recognized symbols of healthcare excellence. It accredits over 22,000 healthcare organizations and programs in the US alone, setting high standards that are meticulously enforced through rigorous on-site surveys. TJC is known for its rigorous standards, which cover every aspect of healthcare, from infection prevention and control to patient rights and medication management. The Joint Commission's approach is comprehensive, often linked to improved patient outcomes. However, this rigor comes with a cost. Smaller or less resourced hospitals often find it challenging to meet these demanding requirements. In India, the National Accreditation Board for Hospitals and Healthcare Providers, or NABH, is at the forefront of healthcare quality improvement. Part of the Quality Council of India, NABH was established in 2006 to bring international standards to the diverse and complex healthcare landscape of India. NABH's standards are comprehensive, covering patient safety, quality management, and clinical care. These standards are adapted to fit India's unique challenges, from its bustling urban centres to its remote rural clinics. NABH has made accreditation accessible to a broad range of hospitals, offering tiered programs that allow smaller institutions to achieve recognition and improve incrementally. In Australia, the Australian Council on Healthcare Standards, or ACHS, leads the way in promoting continuous quality improvement. Since its establishment in 1974, ACHS has become synonymous with excellence in healthcare, not only in Australia, but also in several countries across the Asia-Pacific region. ACHS's Evaluation and Quality Improvement Program, known as EQUIP, emphasizes a cycle of continuous assessment and enhancement. ACHS encourages hospitals to engage in self-assessment, fostering a sense of ownership over the quality of care. However, like other accreditation bodies, ACHS faces the challenge of ensuring that smaller hospitals can meet its high standards without becoming overwhelmed. In France, the Haute Autorité de Santé, or HAS, plays a pivotal role in maintaining the quality and safety of healthcare services. Established in 2004, HAS oversees not just hospital accreditation, but also the broader aspects of healthcare regulation in France. Its accreditation process involves a rigorous assessment of clinical excellence and patient care, ensuring that hospitals meet the highest standards of healthcare delivery. However, like its counterparts, HAS grapples with the challenge of maintaining consistency and fairness across a diverse healthcare landscape. Despite their noble missions, these accreditation giants face a labyrinth of challenges. One of the most pressing issues is the tension between standardization and localization. Global standards, though rooted in best practices, often clash with the realities of local healthcare environments, especially in resource-limited settings. Hospitals in remote or impoverished regions may struggle to meet standards designed for well-funded institutions, resulting in inequities that leave some hospitals and their patients behind. Resource intensiveness is another formidable hurdle. Accreditation demands significant investments of time, money, and human resources, which can be crippling for smaller hospitals, particularly in developing nations. The high cost of accreditation often means that only the wealthiest hospitals can afford it, exacerbating disparities in healthcare quality. Moreover, the drive to achieve accreditation can sometimes foster a dangerous compliance mentality. Hospitals may become so focused on ticking off the required boxes that they lose sight of the ultimate goal: continuous improvement in patient care. This checkbox approach can lead to superficial adherence to standards without real, lasting changes in clinical practices. Inconsistencies in accreditation processes further muddy the waters. Different accreditation bodies apply varying levels of rigor, leading to a situation where a hospital accredited by one body may not meet the same standards as one accredited by another. This variability can erode the credibility of the entire accreditation system. Behind these systemic challenges lie the human faces of accreditation, the surveyors and hospital staff who bear the brunt of the process. Surveyors, tasked with evaluating complex institutions, often face inconsistencies in training and experience, leading to variability in how standards are applied. The surveyor's expertise plays a critical role in the accreditation process. Variations in their experience and training can lead to inconsistencies in how hospitals are evaluated, which ultimately affects the fairness and accuracy of the entire system. Meanwhile, hospital staff are frequently overwhelmed by the demands of accreditation preparation, a burden that can lead to burnout and even a temporary decline in patient care. Finally, the challenge of sustainability looms large. Hospitals may implement significant changes to secure accreditation, but without ongoing support and monitoring, these improvements can fade, leaving the institution to slip back into old habits once the surveyors have left. Accreditation should be the beginning of a journey, not the end. We need to foster a culture of continuous improvement, where hospitals are motivated to keep raising the bar long after the surveyors have gone. As the world's healthcare systems evolve, so too must the accreditation processes that safeguard them. The future of hospital accreditation lies in customization, reducing resource barriers, and fostering a culture of continuous improvement. Accreditation bodies must embrace the complexity of local contexts, developing flexible standards that maintain a high baseline of quality while being adaptable to different healthcare environments. To reduce the resource burden, tiered accreditation programs could offer hospitals of varying sizes and capabilities a pathway to achieving meaningful recognition. The emphasis must shift from mere compliance to genuine improvement. Dynamic standards that evolve over time, combined with more frequent, smaller-scale evaluations, can help ensure that hospitals continue to improve long after the initial accreditation. Surveyor training and standardization must also be enhanced to ensure consistency and fairness. Technology, too, holds great promise. Digital platforms for documentation and data collection can streamline the accreditation process, making it more accessible and less burdensome for hospitals. Additionally, ongoing support and recognition for hospital staff can alleviate the stress of accreditation preparation, promoting a healthier work environment. Ensuring that improvements are sustainable requires a long-term vision. Hospitals should be required to develop quality improvement plans that outline how they will maintain and build on their achievements, with regular follow-ups to keep them on track. The future of hospital accreditation is one of both challenge and opportunity. By addressing the pitfalls of standardization, resource intensiveness, compliance mentality, and variability, And by embracing new strategies for customization, continuous improvement, and technology integration, accreditation bodies can pave the way for a more equitable and effective system. In doing so, they will not only safeguard the quality of care, but also ensure that hospitals across the globe are truly equipped to meet the needs of the patients they serve. As we look to the horizon, the promise of better healthcare for all beckons, if we can rise to the challenge. Like, share, and subscribe to the Medical Appraisals YouTube channel for valuable insights on appraisals, revalidation, and trending topics relating to healthcare and life sciences.